Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAXscope. Thank you for joining me in my latest video using the WAXscope. And here we have a patient who attended with a blocked left ear, and I'm just at the moment performing microsuction, but during the course of the video I will be utilising both the right hook and also the right curette with differing levels of success, if truth be told, and I'll explain the reasons for that as the video continues. So I've just installed some medical grade olive oil spray to try and bind this wax together. The surface is quite soft, although at the base where I was there a moment ago, there is a strong skin adhesion, making it difficult to loosen this wax plug from the floor of the ear canal. So I'm just working away in this region here, and you can probably see how strongly adhered it is. And the key to removing this wax is to kind of loosen it from the canal walls to immobilize it. Once I've freed the wax plug, I can then try and come away towards the entrance. And I'm using our medium-sized specular here, which has got an outer diameter of 4.25 millimeters. There is a smaller specular size if required for pediatric patients or adults with narrow ear canals, and that has an outer diameter of 3.5 millimeters. And then we have two larger ones. We have a 5 millimeter and a 5.75 millimeter. So you may have just seen me there working all the way around the edges, bringing it away from the back part of the ear canal, the floor, the front section, and also the roof of the ear canal. And I'm just, again, focusing more here at the floor. I think this is where I need to really separate the wax plug. So I'm just getting a suction grip and lifting up, lifting away. And you can begin to see the underlying canal wall. And now I've immobilized the wax plug. Now it's ready to come out of the ear. But the second challenge we have is that this wax plug is beyond the second bend of the ear canal. So the ear canal can be separated in thirds. The outer third is about 8 millimeters in length. And contained within the first third of the ear canal is the first and second bend. So the ear canal has got an S bend, it's got a sigmoid shape. And the region between the first and second bend is the narrowest point in the ear canal. So because this wax plug has developed beyond the second bend, it's a lot larger than the region between the first and second bend. And we call that an isthmus, a narrowing. So I'm now trying to wriggle this through, but suction alone is not going to enable me to remove this. So I'm going to use a combination of an ear hook now and a bit later a curette. Now, the ear hook had limited success, although I was able to embed the tips. I was able to first of all glide the right hook in between the gap between the wax plug and the roof of the ear canal. And although I managed to embed the tip into the core of the hook, as I was extracting it, it just cut through it like a hot knife through butter. So although it didn't remove the wax, it did kind of dissect it, which will help in its removal because the plug is not as stubborn now. So I'm just trying to bring this through a little bit more, and then I'm going to revert to the curette. And similarly with the curette, although it didn't remove the plug in its entirety, it did take portions of the plug of the wax away, which decreased the size. And once we decreased the size, I was able to eventually drag this through and out of the ear. So where all those hairs are on the right hand side, that's the first bend. And you will see some flesh on the left hand side of the screen in a moment. That's the patient's second bend. So just to the left there, that was the second bend. So I've just gone to the roof of the ear canal. I'm gliding through the right curette. Although there wasn't much of a gap because the streamlined profile and design of the right curette, I was able to glide it through. And I'm slowly bringing it forwards. So it's smeared, because of the wax is quite soft, the core, it's smeared some of it at the base of the ear canal. So I'm going to go back in once again. I'm going to go a bit deeper this time. So I'm trying to leverage the plug out in its entirety. And as I'm bringing it forwards, see some of it came away, some of it separated, but the remainder just smeared against the canal wall. So I've reverted back to microsuction. I've just installed some medical grade olive oil just to provide some lubrication. So similarly to when you've got a ring stuck on your finger, you may use some soap to try and lubricate the ring and allowing you to remove the ring off your finger. So that's work to treat. As you can see, I'm now bringing this through the entrance. and it was quite a considerable plug. And I'm now going to re-enter the ear. We're going to have a good examination of the eardrum, but before that there's just some soft wax on the anterior canal wall. So this is the second bend actually. And beyond the second bend, the ear canal somewhat straightens. And I've just got the eardrum in focus. You can see all the blood capillaries and blood vessels supplying the handle of malleus there. And they're very distinct, as you can see. And I'm just having a good nosy around. So this patient in their right ear previously had a canal cholesteatoma, for which I referred them to ENT, and they subsequently had surgery. So I'm always just looking around the canal wall just to make sure I'm not missing anything. Well, I hope you enjoyed that video, guys, and if you're interested in the WAXscope, please do email info@clearwax.co.uk. Thank you, bye.